emerging infectious diseases can cause. So the attention shifted from endemic infectious diseases and non-communicable diseases to what we call global health security agenda. And so when Africa CDC came, you had the director this morning. The Ebola was still very fresh in everybody's mind. The strategic pillars then were geared towards detection of infectious diseases. But in 2020, with the pandemic ongoing, the leadership of Africa CDC took that decision to operationalize the division that was created back then but was not operationalized, the Division of Disease Control and Prevention. So the Division of Disease Control and Prevention do not have a strategy or a strategic plan as was done for the other pillars of Africa CDC in 2017. So we felt that in order for us to be timely for the strategic planning, the second strategic plan for Africa CDC, 2022 to 2026, we should start early. And this is the genesis of how this process started. So with the support from partners, chiefly among them, the UK Public Health England, we began the process of gathering evidence and delivering and consultation to develop our flagship strategic priorities and associated activities. Ultimately, we wanted to develop a strategy, an African-owned strategy for the control and prevention of non-communicable diseases, but also communicable diseases, the endemic ones, because the division also have oversight on communicable diseases. For the non-communicable diseases, what we are doing today is the final consultation phase. And if I tell you, we hope that before the end of this year, we'll have a full strategy, an Africa CDC-owned strategy, validated by the member states for prevention and control of non-communicable diseases, injuries, and mental health. We want to go one step further to present this strategy to the African Union Commission so that it becomes an African Union document. We have here with us the Deputy Director is chairing this session with so much experience, and we're getting a lot of guidance from him on how to proceed on this. So because we want to save on time, the presentations in the morning have already set the stage for us to understand the epidemiological situation for non-communicable diseases and mental health here. We all know we have agreed from the different presentation, both from Professor Kaushik and Professor Sheikh, that it's a big burden on the continent, both non-communicable diseases and mental health. And Dr. Ahmed talked about the disability adjusted life years, that burden that we see with NCDs earlier on. Now, NCD is causing an increasing share of Africa's disease burden and premature mortality. But as the directors of National Public Health Institutes here present will tell you, and the directors of public health here present will tell you, non-communicable diseases, injuries, and mental health do not receive the same attention that others are receiving. But the problem is, in Africa, we have what we call the double burden or even triple burden, because we're still dealing with communicable diseases, but the non-communicable diseases are here with us. And in the developed countries where it's a problem, I think we saw a statistics like that, where the NCD is the problem of the rich. Unfortunately, in Africa, NCDs is still a problem of the poor. So we have to really sit up and look at what we need to do. Now, how did we go about developing this strategy? Distinguished participants from member states. This is not the first time we are consulting member states. So just know that it has been an iterative, fully consultative process. In fact, this is the third time we are consulting member states, and you'll see it very soon. So the first one, when we started in December 2020, the first one was an epidemiological review. We wanted to gather evidence. You can see when Professor Kawashik was presenting today, excellent evidence, but he mentioned something. There are still gaps. Africa is about where you don't see this data. So we looked at the epidemiological review, country capacity review, and then we did a 3 special case country study, which I'll talk a little about in a while. We did our first member state consultation in April. It was online. If you remember April, nobody could travel, so it was online. We did our second member state consultation in October. And then it was followed by internal Africa CDC African Union consultation. The phase 3 is tagged engagement, where we engage with all partners, WHO Afro, WHO EMRO, WHO headquarters, NCD Alliance. I think in that meeting we had over 40 partners attending. We also had interaction with academics and experts. We had interaction with people with lived experience, consultation. So in the process of developing this strategy, some key documents were reviewed. And as you can see, though not limited to them, we have the African Union Agenda 2063, the Africa Health Strategy 2016 to 2030, the previous Africa CDC Strategic Plan. The directors talked about it this morning. The WHO Eastern Mediterranean Region Essential Public Health Function Framework, and many other documents, including some SDG documents. In the end, in order to align with some of these documents, we decided that we are going to use these thematic areas of work. Laboratories and diagnostics. Dr. Eno was here throughout the session. He's the head of division of labs for Africa CDC. Healthcare, workforce, surveillance, governance, health promotion and protection, and finally research. We've talked about research over and over again today. Now, we also looked for areas from the Africa CDC new public health order. What we want to do is, we want all the, like Dr. Ahmed said earlier, all the strengths, initiatives deployed by Africa CDC. We want to bring them to bear in supporting non-communicable diseases, injuries, and mental health on the continent. So some of the areas that we've considered as really, important beyond consideration are the ones we put in the new public health order. And they include, you cannot compromise on having strong African national public health institution. Today, I'm happy to see the Director General of Nigerian Center for Disease Control here with us. I've seen the Director General of the Liberian Public Health Institute. I've seen the Director General of Zambia. We had an excellent meeting with the Deputy Director in Zambia just 2 weeks ago, here with us. But we know that mental health and NCDs are mostly domiciled in the Ministry of Health. But what we are trying to do is, let me give you an example. The Director General of NCDC is here. When the COVID-19 outbreak came, the staff of NCDC were working 24/7. hardworking people, but they were having problems, they were breaking down. And some at the beginning were coming down with the infection. So we had to scramble to set up a psychosocial support mechanism for the staff of NCDC. So that, because if the staff of NCDC should all get, psychologically drained, that is a serious security breach for the country. So we set it up. What we are saying is that even for the national public health institution, we need to begin to consider things like mental health component of emergency preparedness and response. We need to begin to look at evidence that supports taking decisions on non-communicable diseases, because what national public health institutions are there for is to bring down the disease, the mortality and morbidity from diseases. And you cannot turn your back on non-communicable diseases. Most importantly, we need to look for a way that the Ministry of Health and the NPHI will function very closely in this. So strong African institution is our number one. We've said it earlier, the deputy director said it, the director said it, local production of vaccines, medicines, and diagnostics. We can make a diagnosis, what do you call it now? Screening for prostate cancer, which will make a difference between somebody having his lifespan shortened or leading a normal life. If you pick prostate cancer before it breaches the capsule, then you just excise it and the person goes back into his normal life. But the moment it breaches, it's a different ballgame. The same thing with breast cancer. The same thing with cervical cancer. So, but we need those things. We need is it a mammograph? Yes. And again, this also goes hand in hand with workforce. We need somebody who has the capacity to do a pap smear. We need leaders in non-communicable diseases and mental health. Africa CDC is supporting leadership courses in surveillance, laboratory, and different. We need to support leadership courses in non-communicable diseases and mental health. So this is what we are talking about. Partnership. Trusting partnership. Like I said, we've worked with all partners drawing up this strategy. So these are very important things where I just wanted to put. The results, I'm not going to waste time because we were trying to save on time. But for the desk review, we know that, of course, we've talked about the lack of data on this. We were able to make estimates on the global burden of diseases, supplemented by peer-reviewed journals. And in the end, the wider determinants are, of course, the socio-economic, commercial, environmental, etc., that play very big role in the development of non-communicable diseases and, of course, environmental pollution. The DEX review, data from 2019 WHO Country Capacity Survey, the WHO Mental Health Atlas, the NCD governance, all of this shows that NCD governance remains poor in Africa, with many countries reporting no specific unit, department, policy, or strategy, gaps in surveillance activity. And in 2019, only 1 out of the 3 countries reported HPV vaccination program, another vaccine preventable cancer. So large gaps in availability of medicines, technologies and diagnostics, public healthcare system, and as every speaker has spoken today, poor financing. We did country case study in Rwanda, in Kenya, and in Nigeria. And the ask, just to summarize, for Africa CDC is political commitment, advocacy, what they say, what those countries, when we spoke to the experts in mental health, NCDs, academics in that country, the 3 countries, what they were saying Africa CDC should have a comparative advantage in helping them is advocacy for political commitment, resource allocation, stigmatization, and reduce industry interference. This came out very strongly. Capacity building, workforce development, of course, integrating into, finding a way to integrate NCDs and mental health workforce development with what is already happening in the other aspect of health. And this was one thing area that I felt even Africa CDC will have lessons to learn. Then direct technical support. They wanted us to support the countries directly, either by sending people with expertise in pool procurement. Dr. Ahmed talked about what they call it now, preventive effectiveness. That's market. What they call it, market shaping, and all of that. So they want us to support them in this regard. So the first member state consultation, this was done through Zoom, and we had over 40 member states present. They wanted, we discussed key challenges and priorities, which include advocacy for political support is still coming up, shared data platform, integration into existing surveillance system, support approaches for community engagement and prevention. All of these issues have come out today, even this morning in our discussion. This was very interesting. Reduce dependency on international bodies. It will be very interesting, but we will see. Training and addressing brain drain. Another thing that came out very strongly today, the gentleman from DRC hit the nail on the head. Support for procurement of medicine, technologies, and diagnostics. Probably learning from what happened during the COVID-19 pandemics. When you go to a village and a woman with depression that can be treated with just $20 in a month, we need to travel to a city hospital that Professor Sheikh just spoke about, 100 kilometers away, spending $50 to go and back, through and fro. She could afford that $20 for 1 month to buy the medication, but she cannot afford that transport. So how do we do all of this? And finally, support research and translation to policy. We did internal consultations where we met the director, the deputy director, we've been talking about multi-sectorial approach. The African Union is the bedrock of multi-sectorial approach. You had the Commissioner of Agriculture spoke this morning. The Commissioner for Trade and Industry will have been with us, but she's on a trip. What that means is all of these commissions have spokes to the industries, transportation, education, that we think we need them for the control and prevention of NCDs. In this regard, what came out of this consultation is that we need to set up a technical working group, which would, when it comes to implementing the strategy that we have. The second member state consultation. All of these consultations we did before we even drew up the long list. We presented the long list to the second member states during the second member state consultation. And what we are asking them is, you have given us these priorities. We've looked at it, we see that it aligns with what WHO, AFRO, WHO, EMRO, WHO, HQ, what UNICEF, NCD, many partners are doing. But can you tell us which of these should be high, medium, or low priority? Which of them should be short, medium, and long-term priority? We had 39 member states responding to our survey. You can see those member states in colors there. It's very interesting. I won't go into this because we are trying to save time. If you take priority 9, for instance, or let's say priority 6, 3.8% of member. Priority 6 is what now? Priority 6 is building on existing initiatives and systems that have or are being developed for the control of communicable diseases to build on areas of synergy. So 3.8% think it is of low priority. 24.5% of the member states think it is of medium priority. Overwhelming majority of member states think it's of high priority. So this was just to give you an idea of what we went through to ensure that